Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Republican Representative Romaine Quinn of Rice Lake is seeking re-election in the 75th Assembly District. Representative, welcome back to WisconsinEye.
Thanks for having me. Good to be back.
I ask incumbents this same question. If you're re-elected, top priority in the next session?
Well, how do you pick just one? And so
One or
obviously,
two or three.
right, so I mean, our district right now is ravaged with methamphetamine. That is a very big problem.
Yep.
Road funding is a big problem. School funding is always an important issue because, as you know, in rural Wisconsin, our schools are sometimes at the heart of our small communities. Broadband funding, something I've worked very hard on, is important. We're making progress, but still on the forefront. So we have a lot of issues that are not unique to rural Wisconsin, but some are, and so we continue to try and work on all of them. So I don't know if I could pick just one.
Well, let's go back to the methamphetamine, which you said your verb is ravaged. That's accurate, tragically.
It is.
And you voted for all the Hope bills.
Yep, absolutely.
What potential next steps in fighting the epidemic?
Well, I just want to give a shout out to Attorney General Schimmel, who's really done everything he can within his budget to bring awareness to the problem that we have. We started the No Meth campaign right in Barron County. Our Sheriff, Chris Fitzgerald, has been on the forefront of this. He's a leader statewide. He talks all over. So again, it's awareness, it's treatment, it's thinking outside of the box. So I think what the state can do more of, what we need to do more of, is really try and support local approaches to addressing this. So in Barron County, we're looking at halfway housing. How can the state support that? No one wants to spend money on housing for drug addicts, but it's a component of rehab. The drug is very addictive, but it's all-encompassing because you need accountability. So if you don't have enough DA positions to get these cases through the court or enough public defender positions to get these cases through the court, where's the accountability? I get locked up, I get let out, my trial's not for months and months and months, I'm still using, so it's frustrating cops. So I think even our adding prosecutor positions was important. So it's a all-encompassing issue. Again, meth is very devastating. We've dealt with it before, but now it's all coming from Mexico and across Highway 8 from the Twin Cities right into our district. We're a corridor for it. And so it's busting our county budgets in terms of foster care and placing kids in homes. And so it's an important issue that the state does need to do more to address.
You also mentioned another important issue is transportation. The gridlock and the impasse in the capital, or how we pay for the future of highways.
Yep.
Your caucus put out a plan. It didn't get enacted. Where do you want this debate to go next? How would you solve our highway funding issue?
Sure, and as you know, the budget was held up because just because Republicans control everything doesn't mean every Republican has to agree on every single issue. And so I held a meeting in my district. I invited every public elected official from every unit of government across the 75th Assembly District to sit down and tell me, what is your mill rate? How much are you spending? How much would you like to spend? What's your future plan? How much further funding do you need? And we had a good conversation. It confirmed what I already knew, that town roads need more money. County roads need more funding. Our municipalities do an excellent job, and I come from a local government background with the funding.
Former mayor.
What they do have, correct. Yep. And so we've had Secretary Ross up in our district. He has agreed as well that we need to spend more on local unit government roads. And so a big part of this is not just new money, but it's shifting where you spend it. When over 70% of the dollars goes towards your interstate or mega projects, we need a reprioritization of where the funding is going. So why on earth would I vote for a gas tax increase if it just means we're going to fast track another $500 million project in the southern part of the state? And so it's not a knock on my colleagues in the southern part of the state. We need commerce flowing as quickly as possible through those areas with good interstate systems, but there has been a neglect on our rural roads. I know the governor just came out with a 50% increase for county roads.
Aids, yep.
I think that would be a huge step. I've crunched the numbers for Barron County, not my other 5 counties yet, but it's an important step. But what about towns? What about municipalities? And so we need more funding. And the biggest piece is I am totally against the amount that we are borrowing right now. And that's where a lot of us drug our feet. We were willing to drag the budget process out and make it late because we did not want to borrow that much funding. And so we found savings. kudos to Secretary Ross, hundreds of millions in savings. We've done every reform that I can think of. We've done the audits, and so now we're going to sit down on the table and say, you know what? We are not borrowing this much anymore, and that is not a Republican principle, and I think we need to do a better job at reducing our reliance on bonding.
When people in the Capitol mention the T word, tolling, your position?
Well, if it's not my district, no, right. But I think we could do smarter tolling too. When you look at some of those studies, just the massive infrastructure and the cost that would go into that, the bang for the buck just isn't there in my mind. Why would you spend literally a quarter of every dollar you take in just maintaining and putting in infrastructure when you have, for instance, a gasoline tax that is a user fee? You know, if something has to go up, I want people to pay, those that are using it more, pay more. You know, so we're not registration, dinging grandma and grandpa who literally just drive to church and the grocery store and back home. You know, why should they pay more registering every year when they're not the ones beating up the roads? So I think we can come together and truly find a fair, sustainable, long-term funding solution because our towns need it, our counties need it, the people deserve it, and then those in the construction industry deserve to know the consistency there in some of their work because they bust their tail all summer long and into the cold months, 50 to 80 hours a week to build these roads for us.
As a former mayor, you had to deal with levy limits. They've
Yep.
been around 13, 14, 15 years. You've also heard some former mayors complain that it hurts their ability to provide services. Do we keep them to control property taxes, dial them back, loosen them, or get rid of them?
See, I've heard from school districts on this too, but we do allow communities to go above their levy limit. So for instance, for infrastructure or taking on bigger projects, you're allowed to go above your levy to make those payments on some of those projects. But for everyday services, I think they do play an important role because they do hold us accountable. Because there were things that I wanted to consolidate or change in Rice Lake, and I know that we never would have taken a tough vote if there was an easy way out. And so it almost gives local units of government, local leaders, the backing they need to say, maybe this is the right decision. Maybe we can have a public works department instead of a street and utility and fire and police all separate, things like that. So I would keep them in place because I think it ensures more accountability overall on all units of government, and there still are mechanisms to work around that, and they just have to go to the taxpayers and say, can we go above the levy and let them choose? And I don't think there's anything wrong with that, and I think the public still supports that accountability.
You mentioned that you've been talking to school officials, obviously. You voted for a budget with $600 million more in state aid to K-12.
Yep, it was big.
When your local school officials say, thank you very much, but we think we need another big increase. Do you agree? How well funded are our public schools now?
They don't all say that. And so each school district is unique, and it's not always about how much funding is in there. Again, it's how we spend it, similar to transportation. So I'm a member of the Blue Ribbon Commission on school funding, where we have dug deep. We have traveled all over the state, just Tomahawk, just south of here. We've been to Milwaukee and Madison and Fenimore and La Crosse, and we drug them up to Turtle Lake, to get some legislators out of Milwaukee, and there's another world out there. And so it's about prioritizing where we're spending. So for instance, my wife and I bought some land just out east of Cameron. We were in the Cameron School District. And if I were to go just north of that and wind up in the Birchwood School District, I would pay half as much for my school as I did just a few miles south.
Half.
But my incomes are different, so why there's so much disparity and so much different and complexity in this issue, it's not a good idea just to say we just need more money. Even when we talk about 2/3, if we go back to 2/3 funding, well, 2/3 is not funding Turtle Lake or Spooner or Birchwood. They're not getting 2/3. They're not getting any state aid almost on some of these districts. So 2/3 means different things for different districts, and so that's why I've learned a lot on this subject, and I look forward to recommendations that are going to come out of this commission, because we do need to take into account further issues like declining enrollment, the cost of special education. I don't think that's controversial. I think the state can step up and play a bigger role in educating our kids with special needs and not relying just on local taxpayers. So there are some unique solutions I think that are going to come out of this. They're going to cost money, but I think we're all open to that, to see what that is and keep an open mind on some of those fixes.
The voucher, the choice program has expanded Milwaukee, Racine, now statewide.
Yep.
You want to see further expansion of it?
Well, it is statewide, so I'm not sure what you mean by further expansion, like
You could-
income limits,
Yeah,
or
you could change the income limits so more families would qualify.
Sure. So in my district, I think a lot of families would qualify already. I mean, it is somewhat restrictive. So for instance, McCain Foods, big maker of food products right in Rice Lake, If mom and dad are both working their starting wage, they do not qualify. And so it is fairly restrictive depending on incomes, but I think that's okay for now. I've made it very clear that I do not intend to use this program to subsidize families that can afford the option, because it's about allowing that choice and giving that choice to people who can't afford it. Now, it's easy to say, if you don't like your school district, move. That's the Democrats' answer for Milwaukee, move. Well, I'm already in poverty. I've been there for generations. I can't just move, So I don't know why there is such fear and stigma around giving people in poverty a choice when it comes to where their kids get educated. So I've always been supportive of allowing parents to make that choice.
The debate over whether we need a new state prison. Green Bay and Waupun were built in the 1800s.
Right.
The debate over future juvenile prisons. Do we need a new state prison?
I think if it makes sense dollar-wise, and from what I've seen so far, it does. When you talk, like you said, you talk about we have prisons in operation that are over 100 years old. Well, I think we handle things a little bit differently than 100 years ago. So if it's conclusive that it'll save us money, it'll save on staff, it'll make our staff safer. We know that's been an issue in certain places. I think there is a need for that. And it's not about throwing more people in jail. It's about being efficient with what we're doing. I think the last budget or one of the studies came out, we're putting $26 million in upgrades or fixes in some of these really old prisons. Well, if I can build a new one, it might pay for itself, in 10 years or 15 years. So I think we can look at the numbers. Again, people say spend the money on schools, not prisons. Well, you still need a place for the worst in society to be kept, and it's not in our neighborhoods.
The package of Foxconn tax breaks, tax benefits. Now, Kimberly-Clark wants essentially basically the same type of tax breaks, tax benefits. A larger question is, when should state government help private companies?
Well, I think we need to look at it case by case and situation by situation. So Foxconn is a huge boon for the state of Wisconsin. You're talking about $51 billion in additional GDP. You're talking about a $2.85 billion exchange for a $10 billion plant and $10 billion in wages over that same period that deal will be paid out. I think Foxconn is actually a new model for us to make sure that our deals are accountable, because we want to see tax receipts and checks cashed before any company benefits from any state subsidies. So, perfect example, we've got Johnson Truck Bodies in Rice Lake. The state of Georgia has been trying to steal them from us for quite some time, and so we've been looking at ways, can we build them a building in our industrial park, get them off the lake, develop some nice condos and grow Rice Lake, but whose job is that? So can we cobble together tax credits or find a developer to build a building for them because the company won't do it, but get them to move? So there's a number of things where we can be creative. Obviously, you don't want to give the house away, but I think you can look at it case by case and analyze those differences and make that decision from there.
You were one of those that voted for Kimberly-Clark when the Assembly passed it, though, correct?
Sure, and I think, honestly, it is amazing to me how political these issues have gotten. And I think no matter what we do on Foxconn or Kimberly-Clark, we're going to get grilled for it, because if you vote no on Kimberly-Clark, how could you give a foreign corporation a deal and not someone that's been in Wisconsin? And so it's unfortunate that it's come down to this. I did vote for Kimberly-Clark partly because of that, because it's very hard for us, I think, to turn around and say no thanks. But the Senate, I don't know what they're planning on doing. They may come back in and work a different deal. I think we're open to that, depending on what that may be, and we'll go from there.
Let's talk about health care. How would you preserve and maybe expand health care in rural Wisconsin?
Well, we've been working very hard at that. So if you remember, I was one of the leaders that started the Rural Wisconsin Initiative.
Yep.
And so we developed a number of bills to try and address the health care issue. So one, we extended or added funding for the RIPRAP program, the Rural Physician Residency Program. Part of access to health care is having the providers there. And so I had a budget amendment last session to provide grants for rural hospitals to bring in advanced practice clinicians to be able to do their clinicals there. So for instance, my now cousin-in-law is a nurse practitioner. She had to go to the cities from Baldwin to do her clinicals. They offered her a job there. She could have moved her family and 5 kids to the cities from Baldwin. Fortunately, she stayed in the area, and that makes a difference for schools and you name it, just in terms of our population. So why on earth are we not giving these people the ability to do their clinicals in the places we need them the most? And so that's why that was an important first step too. Pre-existing conditions, the Assembly voted for that. I know we all have family and friends with pre-existing conditions we must protect. And on top of that, our reinsurance program as well that looks to lower premiums for those in the exchanges who have been dealing with skyrocketing prices. And as we know, Molina Healthcare has come back in to offer plans, and we're looking at maybe a 4% decrease in premiums, which is a nice change from a 44% increase. And so these are all important steps. We need to continue to make these investments to get people quality access and access that they can afford.
Are you hearing from hospitals and other medical providers about low Medicaid reimbursement rates?
Yes.
You think we're at a tipping point that threatens the quality of health care under our MA program?
I think it depends on the hospital, on the amount of patients they have. It depends on the nursing home too. We've got nursing homes that are really struggling right now because they have higher and higher patients on Medicaid. And so that's why I was very supportive of the DISH program when we funded it. In the first budget I was in office, there was talk about getting rid of it. And now this budget, we increased it and made it permanent. So we're not fighting about it each time. And that specifically targets dollars to rural hospitals that have a disproportionate Medicare patients or Medicaid patients in their hospital. So we have hospitals that receive those payments in my district, and I'm very supportive of that.
Have you followed the pilot program between state government and Delta Dental that provides dental care for low income and some of these regional clinics? Do you have any of the clinics in your district?
I think one was in Polk County. So I represent part of Polk County, but not in where the clinic is. So I'm excited to see the results from that. But we have a federal clinic, North Lake Clinic, not only in Turtle Lake, but in Birchwood. And in Birchwood, they offer free dental care or reduced dental care on that sliding fee scale. And even for those, for instance, that are in an abusive relationship, maybe your husband won't give you money to get care. You can come here, no questions asked, regardless of what you two make, and get that care that you need. And so we have those available. And as I talk with county leaders and others, sometimes we're not all on the same page knowing what accessibility there is. So how on earth would someone in poverty know what's out there? So I think we need to re-identify the resources we have and make sure everyone's getting the amount of access they can, and then look at, can we expand something to even improve that?
Have you heard an issue from caregivers? AARP estimates that 578,000 Wisconsin residents provide care for a family member or a neighbor. So would you support laws or rules that require hospitals to recognize and work with family caregivers, when a loved one is hospitalized?
That's interesting. I guess
this issue on your screen?
Well, I didn't know that was really a barrier because, so my grandparents took us in when my parents divorced, and they were caregivers for us and my brother and sister growing up. And now we've taken them back in as they've gotten older and to provide care for them. And so I've really heard an issue of people running into the issue. I could see where a neighbor, maybe you don't have family and that neighbor is that sole provider for you.
Right.
I just don't know legally how that would play out, but if that is an issue, I'm open to looking at that, absolutely.
The bills in the Capitol that would legalize recreational marijuana and medical marijuana, your positions?
Well, I was the first person to sign on to our hemp bill last session, and I was the only Republican to sign on to that. I'm like, I can already hear it, the 24-year-old, smokes pot, and of course he'd sign on to the hemp bill, which hemp is not pot. And so I'm very much a libertarian on this issue. I'm not naive. I went to college. I didn't smoke myself, but I had friends that did, and they still got up and they went to work and they went to class, and there's this stigma around it. I know there are issues with that, but at the same time, we're willing to look the other way on how devastating alcohol can be from alcohol abuse. But it's culturally acceptable. So it's okay for people to go out and get drunk, but it's not okay for someone in their own home to stay in their home to smoke once in a while, and maybe if they're self-medicating on something. So I think it's an issue we can look into. Especially on the treatment side, because I, as a state legislator, it is not my business to get in the way if you have a health issue where your doctor thinks something can improve your health. That's not my job. And I was supportive of allowing the CBD oil. I know people in our district that are going to benefit from that. And the right to try bill, exactly. I mean, if there's a treatment out there that's not approved yet, who cares? You're dying. You have the right to live as long as you can. It's your life, and I'm not going to get in the way of that.
Differences between you and your opponent on November 6th?
I think I have a solid track record of being effective for my district. So whether we're talking about funding for aquatic invasive species that my district cares about, conservation funding, or rural Wisconsin initiative bills deal specifically with the tornado that went through our district, healthcare bills specifically that help rural Wisconsin. I have a solid track record, and part of being a representative for your community is knowing your community. I've been born and raised in the 75th Assembly District. I dedicated my entire adult life from serving on city council at 18, mayor at 19, getting my college education and coming back to the legislature because I'm committed to improving the lives of people in my district, and I know my competitor just moved here a couple years ago, and I think, again, it's not just issues, but being able to represent the communities, you have to know the people and the district too.
Republican Representative Romaine Quinn of Rice Lake, seeking re-election in the 75th Assembly District. The election is November 6th. Romaine, thanks for talking to WisconsinEye.
Glad to be here.
Thanks.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.